In cancer in general, and maybe breast cancer specifically, we are developing newer so-called personalized tests that look at a patient's particular cancer and characteristics of that cancer that help us determine the best treatment for her situation. One of the biggest advances in breast cancer in the last 5 to 10 years has been a test called Oncotype DX. This test was developed by a company in Northern California, Genomic Health, who have found what they think are the 21 most important genes in determining breast cancer recurrence and potential benefit to chemotherapy. So this is a test that we use very commonly, especially on patients with estrogen receptor positive, lymph node negative breast cancer. And this gives us a good sense of their potential risk of recurrence, and also equally importantly, whether they would benefit from chemotherapy or not. It's a great test, and since its development has allowed the patient and the physician to avoid chemotherapy in many situations in which in the past we clearly would have given chemotherapy. It's a great test. It's now expanding to women with a low number of positive lymph nodes to see if that biology still holds true, especially in the sense of benefit to chemotherapy. So if women with a low number of positive lymph nodes have a low Oncotype score, biologically it indicates that they would not benefit from chemotherapy. So that's a test that helps many women avoid chemotherapy, and at the high recurrence score end tells them that they have a huge benefit to chemotherapy. So it makes the chemotherapy decision much easier, both at the no chemotherapy end and the chemotherapy end.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor. I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor to the best treatment options for her.
Pass it on.